What if we could eradicate a major risk factor for stomach cancer in susceptible populations? A question that stirs hope and the potential promise of a future where the prevalence of stomach cancer is significantly reduced. The grim reality of stomach cancer is that it often progresses to an advanced stage before it's detected, leaving patients with fewer and less effective treatment options. This is a particularly poignant issue in vulnerable communities, where the severity of the disease is often magnified. In these communities, the bacterium Helicobacter pylori is an unwelcome guest. This bacteria is a major risk factor for stomach cancer. It causes gut inflammation and increases the risk of ulcers. But it's not just a nuisance, it's a formidable adversary. Helicobacter pylori infection is one of the strongest links to cancer risk known in medicine. A new study from Sylvester Comprehensive Cancer Center at the University of Miami Miller School of Medicine is targeting this bacterial culprit head-on. The study, led by physician scientist Shreya Kumar, is focused on high-risk communities. These include Black, Asian, and Latino residents in South Florida, where Kumar sees patients in her clinical practice. She has witnessed firsthand the devastating impact of stomach cancer, and it's this experience that fuels her determination to make a difference. Kumar and her colleagues at Sylvester launched a community-based study to test for and treat Helicobacter pylori. Their aim, to identify and eliminate these infections within the community setting. But the task is not an easy one. Not all individuals affected can be reached, and the battle against Helicobacter pylori is far from over. Yet, the study's results show promise. The potential for screening and treating high-risk individuals in the communities where they live or work is becoming a reality. This approach could inform future efforts to expand Helicobacter pylori screening throughout Miami and beyond. This study aims to tackle this risk factor head-on, and the results may be groundbreaking. The fight against stomach cancer is a challenging one, but with studies like these, we're taking steps in the right direction. The eradication of Helicobacter pylori could be a game changer, and the impact on vulnerable communities could be significant. Led by Dr. Shreya Kumar, a physician scientist at Sylvester, the study focused on testing and treating H. pylori in high-risk communities. The methodology was simple yet effective. Bring the testing and treatment to the people in the form of community-based screenings. The team, comprised of Kumar and her colleagues, took their medical expertise to the streets of South Florida, specifically targeting Black, Asian, and Latino communities known to be more susceptible to H. pylori infection. The heart of the study was in its accessibility. Rather than waiting for individuals to come to them, the team ventured out to local health fairs and community centers, extending their reach to those who may not otherwise seek out medical care. This proactive approach was aided by the deployment of Sylvester's game-changer vehicles, which are mobile units equipped to bring cancer screenings and information directly to underserved communities. The study's methodology also included the use of portable breath test machines to screen for H. pylori, an efficient and non-invasive method of detection. If the test came back positive, the team immediately provided free treatment regimens, ensuring that no time was lost between diagnosis and treatment. This immediacy was a crucial component of the study, as early intervention can significantly lower the risk of developing gastric cancer. However, the study was not without its challenges. Despite the team's best efforts, not all affected individuals could be reached. This highlights the ongoing need for community-based health initiatives, as well as the importance of continuing to refine and adapt these strategies to better serve high-risk populations. The study's findings were promising, but not without challenges. Nevertheless, the work of Dr. Kumar and her team is a significant step forward in the fight against gastric cancer. Their study not only underscores the importance of proactive screening and treatment for H. pylori, but also serves as a model for how medical care can be made more accessible and effective for vulnerable communities. The study's results showed potential in identifying and eliminating H. pylori infections within a community setting. The team at Sylvester Comprehensive Cancer Center embarked on this study with a clear objective: to test for and treat H. pylori among South Florida's vulnerable populations, including Black, Asian, and Latino residents. The results were promising. They could indeed pinpoint and eradicate these infections within a community setting. However, it's important to note that this was not the case for every affected individual. The study had its limitations. It was not able to reach all infected individuals. This could be due to a variety of factors, including the limited reach of the study, the stigma associated with testing, or the lack of awareness about the risks associated with H. pylori infection. This highlights the need for further research and more extensive outreach programs to ensure that all at-risk individuals are identified and treated. Despite these limitations, the study's success was undeniable. It demonstrated the feasibility of conducting effective H. pylori testing and treatment in high-risk communities. This is a significant step forward in the fight against gastric cancer. By targeting the infection that is a major risk factor for this potentially deadly disease, we can make a real difference in susceptible communities. But let's not stop there. This study's approach can serve as a model for larger-scale efforts. Imagine if we could implement this testing and treatment strategy throughout Miami, or even expand it beyond Florida. The potential impact on reducing the incidence of gastric cancer is substantial. This study is a beacon of hope. It shows that we can take proactive steps to combat gastric cancer by targeting its major risk factor. It's a testament to the power of community-based health initiatives and the potential they hold for transforming public health. So, while there's still a long way to go, the message is clear. By targeting H. pylori, we can make strides in the fight against gastric cancer. This research is just the beginning. It paves the way for more comprehensive studies and larger-scale community initiatives. The approach used in this study could inform future efforts to scale up H. pylori screening throughout Miami and beyond. The link between H. pylori infection and cancer is stronger than many may realize. Picture this: an infection that not only causes gut inflammation and increases the risk of ulcers, but also has one of the most potent connections to cancer risk known in medicine. Sounds like something out of a science fiction novel, right? Unfortunately, this is the grim reality of Helicobacter pylori, or H. pylori, a bacterium that has been proven to significantly increase the risk of stomach cancer. What makes this even more alarming is the fact that treatment for H. pylori can substantially reduce the risk of developing gastric cancer. A study conducted by Dr. Shreya Kumar and her colleagues discovered that patients treated for H. pylori saw an almost 75% reduced risk of developing this potentially deadly disease. These findings echo the results of numerous other studies, which have consistently shown that eliminating H. pylori can effectively prevent the onset of stomach cancer. Despite this strong evidence, the approach to H. pylori testing varies significantly worldwide. In countries like Japan, where H. pylori infection is prevalent, routine screening for the bacterium is a standard part of regular doctor visits. This proactive approach allows for early detection and treatment, significantly reducing the risk of gastric cancer. However, in the United States, where the bacterium is less common, testing for H. pylori is typically only carried out when patients present with symptoms of infection, such as upset stomach or stomach pain. This reactive approach means that many individuals, particularly those in vulnerable populations like Black, Asian, and Latino communities, may not be tested and treated until the disease has progressed significantly. This study underscores the need for targeted H. pylori screening in high-risk populations in the US, a shift in approach that could potentially save many lives. It's time we take the lessons learned from countries like Japan and apply them here, in our own backyard. By doing so, we can help prevent the onset of gastric cancer, improving the health and longevity of our diverse communities. This study is more than just a research project, it's a community outreach initiative. It's about bridging the gap between medical research and the people it aims to help. This study brought the fight against stomach cancer right to the doorsteps of those most affected, reaching out to the communities of South Florida. The team from Sylvester Comprehensive Cancer Center didn't just sit in their labs, they took their research to the streets. They visited health fairs and community centers, meeting people where they are, in places that are familiar and comfortable. They understood that to truly make a difference, they needed to go beyond the sterile walls of their research facilities. But they didn't stop there. They also employed a unique strategy, utilizing what they call game-changer vehicles. These are mobile units that bring cancer screenings and information directly to underserved communities. This approach allowed the team to reach a larger and more diverse audience, offering healthcare services that may not have been otherwise accessible. The focus of this outreach was to screen for Helicobacter pylori, a bacterium that significantly increases the risk of stomach cancer. Armed with portable breath test machines, they provided on-the-spot testing for community members. The beauty of this approach was its immediacy. As soon as someone tested positive for H. pylori, they were given a free treatment regimen. There was no waiting for results, no follow-up appointments to schedule, and no barriers to treatment. This innovative approach is not just about early detection, but also immediate action. It's about equipping individuals with the knowledge and resources to fight back against this deadly disease. It's about empowering communities and giving them the tools to protect their own health. The impact of this study goes beyond the individuals tested or the communities reached. It offers a blueprint for how we can approach stomach cancer prevention in the future, particularly in high-risk communities. It shows us that it's possible to take medical research out of the labs and into the communities to make a real and immediate difference. This groundbreaking study has the potential to change the way we approach stomach cancer prevention, particularly in high-risk communities. And that's a game changer, not just for South Florida, but for the world.